Hello, everyone. Back to you again this month with an interesting case with Dr. Chris Prue. Maybe you would like to say hi, Dr. Chris, before we start, as I think we could have a few more people joining in the next couple of minutes.
Yeah, yeah. Hello, hello. Happy end of March. So tomorrow, I don't know if you guys do this. We do what's called April Fools, which is April 1st, and it's a national like trick people day.
Yes, April's Fool Day. We do it too.
Okay, good, good, good.
Uh,
Awesome.
So I see we have few people with us, few team members as well. We have Chantal, we have Jason, we have Malika, we have Ramsey as usual, we have Jan as usual, and we have few team members. So thank you for joining us, Emma, Aisha,
Yeah.
Ihab, and go ahead, Chris.
All right. Thank you, Rana. And it's great to be back. It's great to have Rana with us today. And just so I don't want anyone to be too jealous of my
Pink cup.
sparkly water bottle. It's my kids keep taking them, and this is my daughter's, I promise. But anyway, so yeah, so thanks for joining us today. So we do this monthly for the most part, and this month um, we're talking about shoe selection. So we've done this not exactly in the past, and it turned into, well, I turn things into things much bigger than they're supposed to be, but I think there's some interesting opportunity in how people can utilize this. And I've talked about it a little bit also with orthotics, and I'm gonna show some stuff. But so this is our monthly webinar. So if you're new to us, my name is Chris. I've been with BALISTON now for for over 4 years. Wow, wow. So time goes by fast, but and so this is kind of focused on utilization. So when people get their equipment, utilizing their devices, this is sort of an opportunity to go through how the system works. So it is very what we call product centric. I'm not trying to sell you a product. I'm trying to show you, maybe ways that you haven't used it yet, or if you are new to this, an idea of what it actually looks like to go through the system in terms of application. So these are analyses that I've been using as a clinician and a practitioner um, in clinical practice, as well as sometimes in teaching and academia. So I teach biomechanics, and then also in coaching. So we use a variety of different opportunities to highlight the product and really kind of how to use it. But like for me, also it's interesting because I'll have a lot of people that return regularly, and we get into some discussions and kind of look at things a different way sometimes. And what's unique about this too is you'll have some people on this that have had the product for years, and so we get some insight as to a little bit in terms of questions and things like that. So I I try not to do too many, but I like my slides. So I'm going to show a few slides just to kind of highlight, and then I'm going to cut back into the online application. So just to be clear, I do not cover how to set up the equipment. It's kind of assuming that we've already gone through that, we've already done that, and this is really focused on on the data. So let me do a screen share here, and it's probably gonna shoot through and look like something from the Matrix. All right. So yeah, so the series we refer to it is utilizing dynamic movement assessment with key pathologies. So this is a recurring thing. Like I said, we do it pretty much every month. Sometimes take some breaks in the summertime. So we're discussing footwear and um, a little bit of background. So when I started and was utilizing the product, and certainly I came from a background, like I said, clinical, but I used to have a laboratory, and we would do what a lot of people think of when we look at like gait analysis, and we would do it barefoot. I mean, we could do it walking, but if we were really looking at the foot, we would often kind of do it barefoot. And when I started utilizing the system, the product, it became very apparent to me that it really does give me an opportunity to look at the performance of a person in their footwear. And if we think of footwear as an extension of the individual, right, and think of footwear like a prosthetic, where it is attached to the person, and that can influence how somebody walks or runs or whatever type of gait pattern that you're actually looking at. And so it became to me because I was at that time, especially working with a lot of runners, and when we would test some of these runners, it was that some of them had really bad gait, which was strange because they were very accomplished runners, and sometimes we were wearing different footwear, and how interesting that was. And then one of the earlier presentations I saw was one of our clinical folks as well gave a great presentation on footwear and utilizing it. And so I've done a couple presentations on looking at that sort of different impact, because the footwear that you're going to be using during a test is going to be important. So when I'm doing this clinically, and if I am going to use this data, then I want to know the footwear that they're using. I need to make sure that I record that, so that way I test them, I retest them in the same footwear. Okay. And if I'm not looking at the footwear, but I'm looking at a knee problem, a hip problem, whatever movement pattern that they might have, um, I have them wear something that's very, very neutral. That's not overly corrective. That is doesn't have a really high heel to toe drop. Strange footwear, fancy footwear, things like that, because I want it to be as representative of their particular movement pattern. The other thing that I talk about too is when patients come in with a problem, and if they're like an active patient, and I'll show you one here in a second, but what I have them wear, their particular type of footwear, because, we've seen that footwear can actually, be problematic. So when we're evaluating footwear, what are some of the things that we look at? It's really not any different than what we would look at from a normal gait perspective. So we do look at your basic spatial temporal parameters, such as speed and their cadence and their stride length. We certainly look at symmetry, which on the sports science side of things, we're having a lot more discussions with regards to symmetry and sort of handedness, and an expectation if you have a right-handed golfer that they're not going to be exactly the same. But we're not talking about that. We're not looking at sport performance. We're looking at something that's very repetitive, so either walking or basically linear running. And there should be some level of consistency. So symmetry still holds a pretty good value in terms, because we're trying to correct that. The other big example I'll use is if you're not dealing with a sport person, you're just dealing with a general population, they probably should have symmetry, especially when it comes to walking gait. And if they're coming in with a problem, then that could certainly lead to that. And then even a further extension is if you're dealing with people that do have prosthetics or orthotics. And then other metrics, kind of looking at some of the more performance characteristics of what might be important, with some of those shoes. So I promise, quickly go through some of this. But this is the example of, I had a patient who came in, and I've showed this person before, with low back pain. And, obviously he had some pelvic characteristics that, were not structural or permanent, but more had to do with, functional limitations and things like that. And so I asked him to bring in his footwear, and we evaluated with his footwear, and it was very problematic. And so, but because of the area that he works in, he has to wear special shoes, the boots, work boots. And so we couldn't just change the shoes. So we were looking at how could we make his footwear fit more appropriately. And I just use this as an opportunity to think about that because, again, sometimes it's too late. People come to us, they already spent, hundreds of euros on a pair of shoes that they can't return. And so, I don't want to tell them that, unfortunately, yeah, you just have to wear them and they're going to cause you a problem. We can actually fix them with some of the inserts or insoles. And so that's where um, corrective extensions of that footwear, maybe in the form of a full orthotic or something that can be used to, create some implementation and change the footwear. So if we look at the scan, so this is an actual analysis, comes from the actual analysis over here on the left. And so we see that he has pretty normal stride lengths, but you can see his foot orientation and ground contact, the lower one here. Um, he heel strikes very much on the medial aspect, so he's really on um, calcaneal eversion, hyperpronation, and all the way through that stance phase. And then we look at the right foot, and it's fairly normal. And so, again, they're fairly new shoes, and not that we were looking at his shoes, we are trying to figure out what his problem was. Well, he did. He had lower navicular height and dropped arches in that left foot. So in other words, we could correct that brand new pair of shoes that he bought mostly, with an orthotic. Again, the other option is if we're looking at footwear, and this is a very specific problem, but if we're looking at it more from a performance perspective. So we look over on the other side, and he was actually walking at the same speed, but now that we had symmetry in his foot during ground contact, pretty close to it, like this is literally just with the addition of an orthotic, um, it changed his confidence, it changed his performance because his stride length increased by about 5 to 6 inches or so, right? So we're looking at 12 centimeters, which is pretty dramatic, even at the same speed. Okay, so when we're looking at specifically the shoes, there are some specific considerations: rear foot stability and control calcaneal motion, right? Because when they come into heel strike, that's the first aspect that we're going to see in ground contact time or foot in. Looking at the midsole density, because there we're going to be looking at control with regards to the midfoot action as we come into toe down and transition into heel lift. Um, and the width is important too, because as we then, move beyond that rocker geometry, as we go into that toe off position, that stability with a wide, toe pattern in the toe box could be important for some people. Just depends on that particular person. As far as cushioning goes, we don't over cushion typically. We want a certain comfort level, and then we really want it for stability and to make sure that they get that appropriate support. The construction has to do a lot with stability or protection, again, depending on what exactly it is that they're doing, right? And then running is a little bit different. So we're very careful at the amount of cushioning and how much cushioning we actually even need. And it could be that they need a little bit more cushioning on the insole, or they might need it in the calcaneal area, depending on their foot strike pattern. They could be a rear foot strike pattern. They could be a midfoot. They might even be a forefoot or a toe strike, which is obviously more unusual. but that can have an impact, their foot impact. Not only which one would work better, but which one do I actually need? And I'm gonna, look at all of these things. So construction, the amount of support, especially, and because the system we're able to look at that information. And I put together a chart here um, in the chat section or in the question section. Rana will put an email so you can contact us. I'm happy to share this with people because maybe it has some good information that you might be interested. So I put together a chart in looking at some of the biomechanical factors that you might want to take into consideration when you're looking at footwear and characteristics of footwear in the population. So one of the things that I've done in the past was I took four different types of footwear and I measured them in walking gait, and then I did it also in running gait. So some of them, the Under Armour is legitimately a running shoe specifically designed for running. The BALISTON footwear is a walking shoe. The Nike also a walking shoe, and then the New Balance is a low profile minimalist shoe that people might use potentially for being on the field and doing agility stuff and things like that. And so from a walking perspective, you could ask, well, which shoe would be better? So I used to, when I was younger, I used to work in a shoe store. So I used to sell shoes when I was younger as well. And a lot of times people would come in and maybe they want to choose a running shoe if they want to do walking because they think of the amount of cushioning, or they think that their running shoe needs to have a lot of cushioning there. And they really don't have the opportunity to kind of look at those characteristics. So basic things that we look at: the symmetry, the cadence, and the speed. And you can see that they're all pretty consistent. So I walked at the same speed for all of these, but one of them is interesting, and the Nike. And I know people have their favorites of footwear and whatnot. I'm actually not a huge fan of Nike. It doesn't tend to fit me well, but these were a gift from someone that I could not get rid of them. No, not the person, but the shoe. And so one of the reasons is I like a wide toe box. I like to splay my toes and have a lot of room in there. And so Nikes just don't do that for me. And you can see that the symmetry, um, for whatever reason, that particular shoe affected me with regards to that pattern. And then what we can look at was what is some of that performance aspect. So certainly we can look at the gate line and look at the center of pressure through, and I'm going to get into all this in a moment. But then this characteristic over here on the right is the propulsion rate. So this is this ratio uh, from contact into the swing phase. So this is from toe off as my feet get into the air. And you can see that there are some differences, and the one down at the bottom is actually the Balliston. I'm actually on my third pair, and I wear them quite a bit actually when I'm just doing normal things. So you can see that there's some interesting asymmetries in how it impacted my take off into that swing phase, and who knows what it would have been. But what we're trying to say is, that can potentially make a difference in terms of what exactly it is we're trying to accomplish. So if we look at this first one up here, so this one in the upper left hand corner, so this one is that New Balance, which is a low profile, low construction shoe. There's no midfoot support. There's no cushioning in it, so it's a minimalist shoe. And you can see that probably not the best for walking if that was the goal. And then again, not to spend a lot of time on this. So we can use this green corridor, and if we think about what's going to give us the most impact in footwear, and when we're in that ground contact phase, is probably something we want to take into consideration because of the ground reaction forces and the influence it's going to have through the kinetic chain, and potentially leading to some other problems. So this is looking at obviously foot orientation and from heel, calcaneal inversion, eversion, but also in that midfoot stance phase. So again, I'm here in the upper left-hand corner. So we see that there's a very dramatic transition from heel strike and moving very much over into the medial aspect of the foot, especially here on that right side. So definitely over pronating. It seems to correct as we go through that rocker, like we were talking about, the rocker and getting into that toe off. We look at the thin lines in between, and that's the standard deviation. So that's a measure of variability, and that's pretty normal. So from heel strike, the position on heel strike, but again, your footwear is not going to have a dramatic impact when your foot is in the air. It's when it's in the ground, and so there's no stability in either one of these. We look at all the other footwear, and especially this one over here, also on the top, but over here on the right, pretty consistent with regards to the tracking in ground contact, but there seems to be a problem. So this is that Nike footwear. So toe off, right? As I'm going into that swing phase, my foot doesn't really like it. There's so much variability here that that's showing that I'm not responding well into that particular phase. And then so if we look at all these metrics and we separate them, we can see that the one down here in the lower right hand corner keeps me most consistent within the pattern, and gives me the least amount of variability and the greatest amount of support. So boom, that would potentially be the shoe that I'm looking at. So the framework that we're using is, what are we trying to accomplish, walking or running, because you can't, well, you can, but you may not want to use the same footwear for, both of those purposes. Do the analysis and figure out what's going to be most important, and they're a little bit different. So as you can see here, over here, all the way on the left hand side, we can see that we need some supination support because there's over supination on, and I think I'm going to show you one that has that. So there's excessive heel strike with heel inversion, and then there's over supination throughout the cycle in that stance phase. So definitely needs a little bit more lateral support. And then we can see the one in the middle is like the complete opposite. And then we can see the one over here on the far right. There's not a lot of control. So there's too much variability, especially on heel strike and toe off for, through that particular pattern during the walking phase. This is a run, and we're going to look at this in more detail in a second. So there's a slight rear foot heel strike on this particular runner. And so that might be a consideration that we'll want a little bit more support in the cushion. And what we can see here, so we see this transition. So there's landing. And the reason we don't call that heel strike, because it's not specific to heel strike. It could be someone's coming in midfoot or toe strike, and then there is going to be a rocker or a transition phase. So we see that this particular person lands and heel strikes pretty quickly and then transitions into that midfoot. And that could be, depending on, it could be a shorter stride. And that's something else to take into consideration. If you really get into running, you need to do a little bit more education or understanding of what that might look like. And then so there's a quick transition into that flat foot stage. So that probably tells me I do not want a very large transition, heel to toe drop, right? Because it means that there's not a lot going on, and they would slap that foot down if there was too much. Okay. So this one over here on the right, we see that that's actually a fairly normal foot in on a heel strike pattern, and then it's a little bit more gradual in terms of their foot, coming down into that transition phase, and then going off of that first and second ray. So this looks much more normal and fairly symmetrical between the two. I'm going to stop here and move to the analysis system, but I started putting together some interesting stuff that, again, if you're interested in this, we're happy to share that with you. So I'm going to go over to the matrix here. Okay. So you can use well, you have to use a mobile device to collect the data. And so there's an app, Android or iOS. And there's also an online app. So the online app transfers all that data is transferred automatically. So it's the same login and everything. And when you pull up your app, your system, this is the home page that you're going to see. Although Rana's going to show us the new one, which is coming out very soon, which is pretty cool. So we're all excited about that. So in this home page, it just that's me. Hello, Chris, and the number of patients in the last 30 days and some other latest analyses, data that's been collected. Over here on the left hand side, we see the home. So if you click on the home, this is where it brings you. Patients, if you click on patients, it brings you to your list of patients. If you click on equipment, it shows you the devices that you have. So I have multiple sensors attached to this particular account. On settings, you can change your language. I'm an American, and so when I show my patient, I mean, we publish also in the metric system, but when I show patients, they don't know that, so I have to use the imperial system here. But you can change that on yours. There's also a workspace, so I can share, my content with other people as well. So I'm going to go back to the patients, and that will populate. And then I'm going to go down here to show more of those. And I'm going to pull up this particular one because this has the analyses that I would like to show you. So what it does is it populates, and I use all kinds of different codes. You can put their patient names in there because this system is approved by EU MDR as well as the FDA, and so it qualifies in most every single country as far as um, the patient safety and requirements with regards to confining patient information. So basic dashboard, which shows me the latest activities, patient file, which gives me the patient's characteristics, and you can go and you can change them. And then under practitioner analysis, it shows me and creates a list of all of that. I'll come back to evolution here in a second, but so this is going to show me all the different tests I have in this particular patient file. So the opportunities we have, so we have a walk analysis, we have a run analysis, and then we have jumping analyses. So they're built into our general rehab program, sports medicine program, neurology programs. So they're kind of configured to give you the typical type of tests and information for your, patient population. So within mine, I do have, the all of them. So you just choose the one that you actually want to look for. So I'm looking 97. Let me pull up. I'm going to pull up this one. So all you do is click on that. Now they're date and time stamped. You can go in and you can actually change. If I click on this, I can rename the analysis. So if you want to call it the particular footwear that they're wearing, then you can do that if you so desire to do so. Okay. So then it shows you a summary. If you want, when you're taking the analysis, you're able to put in this information. You can also put it in later, like I do right now, so I can make these changes during that time frame. And then that way you can track, things like pain, their problems, their limitations, any aids that they might be using, a cane or a walker or something like that. And this is where you can put in the footwear. So I recommend, putting this in, especially so because people forget they don't wear the same footwear. So let's scroll down. So there's intelligence built into this. And so once you get good at understanding this and go through it a few times, your analysis becomes, very, very quick. And the colors are going to help us with that. So there's three different colors. So we have amber, green, and red. If it's green, it means that it's within the normative values within plus or minus one standard deviation. If it's amber, it's between one and two standard deviations. If it's red, it's greater than two standard deviations. So that's important because if it's green, I won't waste time visually or explaining to the patients, especially after we've done this for the first time. Okay. And so the symmetry characteristic is showing that we've got a 90% symmetry. The other way to talk about that is I have a 10% asymmetry. Now, sometimes that may matter, sometimes it may not. For me, a 10% asymmetry does matter, especially if we're using that as one of the characteristics to use as a guideline in terms of the rehabilitation process. In this case, footwear or something like that. Now, there are these little question marks. So you can put your cursor over the question mark and it highlights that particular metric or biomarker and gives you a definition if you're unsure of what that might be. And then in our walking profile, so it shows us the stride length, and then it shows us the gait characteristics in percentage for the stance phase and for the swing phase. In general, it's 60-40. 60% is going to be in the stance phase, 40% in the swing phase. Because it's walking, we do have a double support phase, and that's this DS or percentage in between. Okay, so it shows us those percentages. It also gives me the distance of that stride. Now, if I do want to get in a little bit deeper, you'll notice up here it says standard and advanced. If I click on the advanced, it gives me a little bit deeper dive into those characteristics. But what's interesting in our system actually creates, is it normal? Is it high? Is it low? And which side is that? Okay. So these are based on the literature and the characteristics that are found within the literature with regards to normative values. So it gives us, in this case, the stride duration, the duration in length of time in milliseconds, the stride length, swing time, and the stance phase. Okay. So this gives you a little bit deeper dive because sometimes when you see that asymmetry, you may want to know which side is the good one, which side is the bad one, because what's interesting is you'll see here that the stride lengths are almost the same, but we see a stance phase on this right side is 66% and 63.7% on that left side. So you kind of need to decide, well, which one is going to be worse, and which one is actually going to be better. So what we do see is we see a very, very short swing time on that right side. So for whatever reason, that person wants to stay on that right side and ground contact a little bit more. And we'll dig a little bit deeper. And again, we're talking about sort of footwear and how I can use footwear to potentially correct that. So the gate line is looking at the center of mass through that contact phase. Now, there's no pressure sensor in our devices. It's using an algorithm associated with ground contact and orientation, and it is correlated to using pressure mapping systems during the development of the algorithms. So it does break it down into the loading, the foot flat position, and then the propulsion. And it gives you you can either do absolute or relative. And we see that this is the percentage. So very short time frame in that loading phase, longer transition into the foot flat. So let's think about that for a second. And if I go up here and think, well, their stance phase is actually within the normal, but their swing time is relatively short. So that probably says to me that they're probably walking a little bit lower on the slower side of what's considered to be normal. So when you're working, with your patients, and the idea is to think about this a couple different ways. If I have a normal person, I want them to walk at typically a normal speed that they feel comfortable with. And I say intently, as though they're trying to get to their gate if they were flying out of the airport, but they're not in a hurry. They're not late. And then there's another way to look at that. So let's say someone does have foot pain, knee pain, whatever the problem might be. I want them to walk at their potentially their more comfortable pace, so I can get a sense of their antalgic position. And sometimes I'll do what's called either dual tasking or overload. I may push them a little bit further if I'm walking on a treadmill, or ask them to walk a little bit faster to look at and see what the impact is. Because sometimes people will configure their gait to a speed that seems normal to them, and it may actually show up normal on the system. But if I want to capture what the abnormalities are, I may have to push them a little bit further. So we looked at this characteristic over here, which is propulsion rate. And so that's that ratio between the hip flexors and the plantar flexors going into that swing phase. So let me pull up the details view here. So this gets into those screens that I was showing you a little bit earlier. So what we see here, this is the foot in ground contact. We call it supination and pronation, but it's as though the foot is more of a block model. So we're not getting into, the detailed aspects of the triplanar motion at that, mid forefoot, but more of the whole foot as we're going through that ground contact phase. So this green is actually what we call the corridor, and that corridor gives us some normative values that we did establish internally as an organization. So you can actually you put your cursor over the number and it gives you that particular number. Okay. And then what we see here is in the foot flat position, there's no standard deviation. So those lines are really tight and you can barely see them. So there's a 1 degree of standard deviation in heel strike on that left side. So they're not moving too fast. And here's what's interesting is over here on the right, this is what it's supposed to look like. So this person has corrected for whatever reason on that side. And in fact, these were um, problematic, like older pair of shoes. And we see this a lot. So people correct and they get stuck in these particular patterns because this is a correction. And we see this in clinical conditions as well with chronic low back pain or chronic other problems where they've used and created new patterns, and they configure to them very, very well. So we see hardly any deviation going on right here, whereas on this other side, on the right side, we actually do want to see a little bit. That's actually normal. And it's that standard deviation that gives us the ability to sort of respond to a changing environment. And then we look over here on the left-hand side, and that shows us um, the foot progression angle, which is that toe out position from toe off through swing phase onto that heel strike position. So in asymptomatic, at least Western individuals, that is approximately -2 to 14 degrees is 2 standard deviations in an asymptomatic population. So there's a little bit of variability there. But again, what I like to look at too is also, the symmetry between the two. So 6 degrees versus 5.1 degrees is pretty normal. And then we also get circumduction. How far out is that leg swinging from a direct straight line from toe off into that heel strike position as we go through the swing phase? So again, it's not normally straight. Abduction is part of the normal gait pattern because we also see hip flexion, knee flexion, plantar flexion, then we go into dorsiflexion to clear the foot as we're going through that ground surface. And circumduction is part of that process. And so we see here that between 1 and 1.3. So this is pretty normal. So it's about a half an inch or um, approximately 1 to say 4 centimeters is going to be considered more on that normal. And then this is an interesting characteristic, especially when I'm looking at older adults. So if I was fitting a pair of shoe for an older adult, I want to make sure that they can actually clear the ground. So that toe box and the length of the toe box from the end of their toe to the end of the foot or to the end of the shoe can be important because if it's too long, they don't know enough neurologically to be able to pick up their foot. So this gives us the angle on the toe off. This is the MTC or minimal toe clearance, and this is the angle of the foot as we go into that heel strike position. So I want to go before we run out of time into a run. So I kind of put two down here to look at. And I did 33. Okay. So running's a little bit different. We don't have as many normative values in running because running is more variable. right? If you look in the literature, and even an individual. So, in other words, as I start to run faster, my cadence will change, my stride length changes, my foot contact, and things like that. So, same thing. I can put in pain, walking age shoes, and things like that. The total time. So you can actually, if you want to have someone run, I'm actually going to be testing some competitive runners. We may do the whole entire 5 kilometers, so you can actually collect data for just lower than about 2 hours, if for whatever reason you wanted to collect that much. We like to see at least 90 seconds or so to get some repetition and enough data points. And so that's why you'll specifically choose walking or running depending on if they're going to have a double support phase. You're going to choose walk because the system has a firewall in it and it's not going to pick up flight phases. Okay. And then likewise, if you choose run, it's not going to pick up any walking because it's looking for that flight phase. So anything double support is not going to be factored into the system. And I won't spend a lot of time on this, but this is a graphical representation. You can put your cursor on those points and actually look at the cadence and the speed at any particular time. So this shows us the asymmetry characteristic and then also the strike pattern along with the strike force. And so from a shoe perspective wearer, you know, this person is a little bit asymmetrical. So they've got a bit of a midfoot strike and then a rear foot strike on that right foot. And so you need to be thinking, well, what would be better? And potentially you may want to introduce an orthotic to create some symmetry if that was something of particular interest. But again, if we want to err on the side of caution, we're probably going to use something that maybe has a little bit more cushioning in that rear foot if they are going to be a heel striker. Or I need to figure out if this person is in training and maybe we're trying to teach them to be a midfoot striker, which is what I would probably do anyway. Because what's interesting is we see the same strike force, so 1.7 kilonewtons. Um, and so with the strike pattern along with their overall strike force may help to decide, do I need more cushioning? In that midfoot strike pattern, I especially probably do not want to use a very large heel to toe drop because of the way that they're landing, and I don't want to have them land in more of that plantar flexed position and probably induce something going on with their Achilles tendon. So we do see that it's very equal in terms of the stride length between the right and the left foot, and their percentages are also going to be very similar. And then we get into the advanced, and the advanced shows us their strike pattern. Now, this is where we do see a lot of that asymmetry, and maybe this is also why it's important to think about that when I go back up here and I look at this rear foot strike pattern on that right side, and we see what's going on here. So they do rear foot strike, and then they transition and they dramatically go into the medial aspect of that foot. So they're probably losing a little bit of control. So this is where I may want to consider either something with a low heel to toe drop, not a lot of cushioning, but an orthotic and configured and especially customized for that right side because they don't have a lot of control once they go into that strike pattern. And then what's interesting on this one is people will say, oh, well, they land and they're landing, really neutral. But remember, they're also landing in a midfoot strike pattern. They're not landing on the heel, so they don't need as much of that calcaneal inversion as someone who lands in a midfoot strike position, right? And we don't see a lot of variability on either one of these, which is, you know, common, especially in trained people that don't do that. I want to pull up another one real quick too, so we can look at. Actually, what I'll do is I'll show you the other feature. So I will go back and pull up. Which one was that? 46. It was this one. So another feature we can do on the walking or the running or the jumping is over here, these three dots, and you click on those three dots, and I can do a compare. So what I'm going to do is I'm going to pull up the other one that I wanted to look at, and that one was 10/20/23. 10/20/23, 14/01. And what you can do is you can actually compare two side by side. So this is really cool, especially if I am trying to figure out different pairs of shoes. They bring in both their footwear, and we can do this comparison side by side and look at the two different types of foot patterns. So we see. Oops, trying to make my screen here a little bit. So we can, again, we can put our cursors over, and we can compare these side by side. I want to pull up the one so we can see it bigger, but hold on just a second. Load more. And that was the 401. Okay. Just so we can see it a little bit bigger. So slightly different. And what we're seeing here is we're starting to see an asymmetry. So now we're up to 4%. Again, I'm not overly concerned with 4%, although there's a trajectory that we're seeing here. The strike pattern is the same, or excuse me, the strike force is the same. We are seeing some slight differences, and we're seeing a rear foot strike on both of these now, pretty close to what we saw on that right side. But the other thing that we're seeing is, so there's a slightly longer stride length that actually has to do with their speed, in fact. But we start to see this asymmetry, and it's shorter on that left side than it is on that right side. So when I go to this advanced, well, that's not right. And so what are we seeing here? Well, we're seeing that this person is about, heel strike, calcaneal striking again, fairly neutral, so there's not a lot of calcaneal inversion, but then they continue and they roll out. So they're not getting a lot of support on this shoe as they go into their transition phase, and they roll off and they toe off on the lateral aspect of the foot, right? And then on this side, we're seeing pretty normal heel strike position, and they really go off onto that first and second ray. So from a performance perspective, that's interesting, but that's why we're seeing this limitation here. They're not propulsing very well in that particular shoe, and we're seeing this in their performance with regards to their stride length, and it's actually creating a large degree of asymmetry. I will tell you that this person, it's more than just the footwear. They actually have a foot problem. They have a cuboid syndrome. And so it's more than, we were doing more than just looking at footwear. We're also looking at, potentially creating some orthotics for this particular person. And so that's why I wanted to pull this one up. So you can see that, so this is that foot. And so we're looking at putting a posting on that side to help control and keep them from going off to that lateral aspect, so they don't go too far into the Netherlands there, and have a negative influence not only on their performance on their toe off, but potentially a running related injury at some point moving forward. All right, I know that was, I don't know, seemed like a lot to me, but maybe it was. So let me go back up here. So what I'm gonna ask Rana, because she wants to show um, the new interface. So we have a new interface, which is going to be super cool, because not only is it going to look different, but there's actually some new features that are going to be part of this release, this new launch that's coming up very, very soon. Yep, there you are, Rana.
Just sharing the screen. So basically, we always be on the weeks.
Oops.
So this is the new web interface. Of course, the whole app has been revamped, changed, and we have some new tests coming, and then we have like new presentation of the results. Do you see my screen?
Yes, yes.
Okay, so basically, like this is my welcome screen, my dashboard, and here I have the different
Oops. I don't know if you froze or I froze. I think that was wrong. I'm sorry. I'm bummed because I want you guys to see that. But I will say next month, so I'm only going to be presenting in the new format moving forward. So kind of excited about that. So we'll show you more of that. You'll see that coming up very soon. So we're in beta testing, not only internally but externally. We've got some of our customers already using it as well to give us a little bit more feedback and things like that. So there's going to be some more metrics and a different interface is going to look a little bit different. What I like about it too, so I conduct a lot of services that otherwise, so in the United States here, we have insurance like many of you do, but a lot of the things I do are not covered by the insurance. And so I need to show my patients that what we're doing is beneficial and that it's worthy that they are actually paying out of pocket for those services. So the interface is also uh, um, more user friendly for me to be able to show patients. Oh, there's Rana. She's got the screen back up.
Okay, so my name is meeting. I just want to do one analysis. This is the new analysis where it's a dance from walking test that makes
Yeah,
illustration the pathological debate. And here you could see the dashboard of this analysis. You could see some indices that we added. So we did have symmetry before, but the new symmetry is way advanced because it depends on more parameters than it previously did. And once you become full here, you could see the parameters that makes up the symmetry. So let's say we look at one of them and we see we compared to the graph. And then let's say if we look at the S2I, which is right body, it's a given parameter that predicts the and as well, the factor to get a different here, right? The orange and green show you like left to reflect what's going on.
yeah, your audio's not clear, but we can kind of see. So maybe I can kind of talk through it as well. So what Ron is showing right now is the gait variability index, and prior to that, she was showing the stride quality index. So these are going to be integration of metrics. And what's good about that is it gives us a scoring orientation that we can use as the clinicians, but also to show the patients. So the stride quality index versus the gait variability index. So gait variability is what it sounds. So this is not, we didn't develop, like this is something that's in the literature and is used for different conditions and fall risk profiles and things like that. The stride quality index, another type of index that is related, to our system. But what it does is, again, it's a really quick and easy metric that gives us a lot of information in a very digestible or very sort of easy format. And then, as you can see, she can click on the different variables that are within that particular index. One is it can give you a summary of the information, but also the recommendations, as well as the details of that index in what exactly the problem may be. So it's adding a little bit more information, but bringing it down a little bit easier. So this is something that has been worked on quite a bit. So we're providing the GBI is a global, well-known type of index, the Stride Quality Index. Another really interesting one, because here's the thing: if you have someone with a limitation, lower limb loss, a fusion due to surgical procedures, we have certain limitations. Like, we know that they're not going to get back to normal. And so with these different types of indexes, it allows us to use different metrics to kind of follow and look at the progression that we can make with these patients. So I hope that does it justice, but we will definitely um, be looking at more of this. Hopefully you're excited as we are, because you can see the new interface. It's very slick. It's very modern. Looks really neat. And if there's you can see that sort of orb on the side of each one of those areas, like where the spatial temporal parameters are. And when you click on that, and I think Ron is just about to do that. When you click on that, you'll see that it pulls up this really nice layer of information that also is part of the recommendations, summary of the findings, as well as the clinical implications that it's going to have on what it is that you're going to be doing with the patients, or information that you're going to be providing them. So I think your audio is better now too. Now, the next layer, hopefully someday, what it will eventually do is be able to uh, do laser and shockwave on my patients, so I won't even have to go to the office anymore. I don't know. Probably not, but I got to do something, right? Yeah. So this is going to be really, really, really cool. Really cool. Just the visuals are incredible, but the output is also something that a lot of clinicians have been really asking for. Okay, so we're about time, and anyway, I hope this was useful. Thank you all for joining us. Reach out to the education email. Certificates can be sent to you. This is recorded, so it will be posted up on our YouTube page. You'll uh, they'll let you know when that happens, but it's also available even prior to that if you want to go back and listen to me flap my gums again and talk a little bit more. But anyway, sorry about some of the internet connections, but we look forward to seeing you next month. And oh man, what else? Exciting things to come. That's all I can say. But looking forward to it.
Thank you so much, Chris. I see there's a question by Ramsey.
Oh, strong heel counters preventing excessive calcium liberation. I haven't seen that crowd limits. That's true. You're not trying to control the heel, which is yeah, absolutely, Ramsey. It's a great point. Um, my take on that is, it also depends on what's going on through the rest of that foot contact cycle. So some people, it may not matter, and running is obviously going to be different a little bit than walking. But if there's too dramatic of a shift, I will attempt to control that, and I've seen great results as a consequence of doing that. And it's easy for me to test. And if it doesn't work, I can rapidly take it out. But if it does if it does work and it seems to give us that better control through the rest of that cycle, then for me it's definitely worth attempting. But I even before I create a custom, I can easily check that with some basic postings or heel cupping or something like that to give us that capability. The other thing too is it 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 also is depending. So when I have people with certain, I don't have them here with me, but one of the things that people are lacking when they hyper focus on like the orthotic to overtly control, and this comes back to like looking at the footwear itself, it's really common. So a lot of these, especially walking shoes, have really flared calcaneal areas along the heel, and potentially is the culprit in causing some of that problem. And you're right, an orthotic's not gonna is not gonna correct that. But if I've made the assumption or I've accommodated for that, then when I do correct calcaneal position on foot strike, I've had good luck with it. And as long as it doesn't cause any problems and seems to be beneficial, then I'll usually continue down that pathway. So yeah, they should buy two pairs of shoes. Well, sometimes because when in classic like here in the US, because there's so much like fitness business, people will buy a pair of shoes to start their fitness journey in January when they make their New Year's resolution, and oftentimes they don't buy a really good enough pair of shoes to do that particular activity. So and the other thing too is like, even for me, like I've part of my living is on my feet, and that they should wear a good pair of shoes to protect their feet. Like a dentist will say, you only have so many teeth, you only got 2 feet, so I kind of want people to take care of them. And we didn't even get into the slop or that potential mobility. We have here in the United States, approximately 50% of the adult population is at least pre-diabetic. And here in the United States, diabetic neuropathy leading to wounds is the number one cause of lower extremity amputation. And so motion control is we're looking at that a little bit more closely. And so yeah, maybe they do need two pairs of shoes, and maybe you should open a shoe store, put it next to the clinic or something like that. But it's possible. I try, and if I can correct things by an insert or whatever it can be. If someone just spent 120 euros on a pair of shoes, is there a way that we can fix that? Hopefully, and I've done that, and it seems to work okay sometimes. I do tell my patients, listen, there's a company here in the United States, Zappos. You can order like 10 or 15 pairs of shoes. You get to try them on, and then you send back the ones that don't fit. So I actually have some patients that will bring in 10 pairs of shoes, and we can do an analysis on them, and they get to choose their footwear. But yeah, in general. And then, oh, so I used to talk about this character when we first came out with our shoes. So adults in the United States, men have an average of 9 pairs of footwear. Women have an average of 14 pairs of footwear. So two is probably not a problem. All right. Well, I guess it's getting late. You guys are probably, well, most all of you, I think, are later than me. But yeah, a shoe store with custom orthotics. But yeah, no, I get it. Anyway, all right. Thank you all for coming. I look
Thank you
forward
so
to
much.
chatting again next week. Thank you, Rana. I appreciate you
Thank you,
very, very
Chris.
much.
Thank you, everybody. Bye.
Ciao. Au revoir. Hasta luego. That's all.